Frequently, I also get asked when I see the initial encounter with a patient as to what the treatment options are and how do we progress in the proper direction. And I explain to the patient that our clinical exam is the first thing as to whether we're examining whatever limb it is, upper extremity, lower extremity, knee, shoulder, hand, etc. After we do a clinical physical examination of the location of the patient's complaint, I will frequently send the patient to obtain plain x-rays of the. This helps to determine by doing an x-ray to showing the bony structures. It does not show soft tissue structures due to the fact that the x-rays themselves penetrate through the soft tissue. X-rays are very good at showing bony changes, including fractures, dislocations, arthritic changes in the actual particular joint if it is a joint. The x-rays also help to show some infectious changes, and they also can bring out tumors. And one of those things is very common. Sometimes you do see that incidentally on a regular x-ray. So if you do have an injury, whoever you've seen, whether emergency room or the orthopedic surgeon, you should always have an x-ray of that particular aspect in order to determine the aforementioned. Once we have the x-rays, we can add that and incorporate that into a treatment plan. It's very important for the patient to realize that x-rays are just basic data collection tools. Another data collection tool is an MRI or a PET scan, in which the MRI is looking more specifically at soft tissue. It's very good for looking at tendons, nerves, blood vessels, muscles, and ligaments. It also can show some arthritic changes in the joints when it looks at the actual cartilage. The problem with x-rays and the problem with MRIs is they are indirect views of the tissue and they're subject to interpretation. Just because an MRI says there's nothing wrong doesn't mean there's absolutely nothing wrong, and sometimes it can miss stuff because of the way the actual technique is utilized. I also explained to the patient that the MRI again is a data collection tool. It's not a treatment option. It helps to aid in the treatment, but it doesn't specifically treat you. Similar studies such as a CAT scan or a bone scan again are data collection tools, and they also aid in the treatment option. One of the most important things to remember as far as obtaining an MRI is that it is a one specific static test, meaning the limb cannot be moved and it's only taken at one point in time and one point in space. The physical examination helps to correlate with the actual testing as far as the radiographs and the MRIs, because this is a dynamic testing, meaning I'm able to move the limb and I'm able to stretch the ligaments. It is ironic sometimes that people think that an MRI is similar to a Star Trek body scan, but it doesn't show everything, and it does miss a lot of stuff. And here is a very expensive piece of machinery that simply cannot move the limb or test the ligament. That's why we'd like to correlate the two between a physical examination and the appropriate radiographic studies.